Moving on now, the World Health Organization says reduction in malaria cases have stalled after several years of decline globally. In its annual report, the WHO says the only solution is to focus on the countries hit hardest by the disease, most of which are in Africa. Although scientists are working on vaccines and ways to control mosquito numbers, prevention measures aren't working fast enough. The estimated number of malaria cases worldwide fell from nearly 240 million in 2010 to just over 214 million in 2015, but then rose by 5 million to 219 million in 2017.
The progress that the world has made in the last 15 years is unprecedented. However, the last 2 or 3 years have signaled a slowing down in the progress and actually stalling altogether. The World Malaria Report 2018 confirms that we have actually stalled, and we have stalled at a high number, still in excess of 200 million cases globally, in excess of 420,000 deaths globally. There's a relatively small number of countries that account for a very large proportion of the global cases. Indeed, 10 sub-Saharan African countries plus India alone account for more than 70% of the global burden of disease. Rwanda, Ethiopia, Pakistan, and particularly India are great examples of massive progress in just 12 months. Particularly in India, Odisha state has by itself reduced malaria in over 40% in just a year, which is a reminder that with the right type of political leadership and commitment, the right tools, the right investment, malaria can be defeated and can be defeated very quickly.
Nigeria is on track to ensure that 80% of its people are immune against vaccine-preventable diseases. That's coming from the Executive Director of the National Primary Healthcare Development Agency at an engagement workshop on emergency routine immunization in Kaduna State. He also revealed plans by the federal government to launch the Basic Healthcare Provision Fund in a bid to provide universal healthcare coverage for women and children.
Achieving universal immunization coverage in Nigeria has remained a major challenge. This gave birth to the establishment of the Emergency Routine Immunization Coordination Center in July 2018, with the aim of ensuring that at least 8 out of 10 Nigerian children are immunized at the appropriate time. 4 months on, these healthcare providers from local government areas across Kaduna, Kogi, Niger, and Plateau states are gathered in Kaduna State seeking to improve their performance. The Executive Director of the National Primary Healthcare Development Agency believes success is achievable with renewed commitment from the low-performing areas as he announces the plans of the federal government.
Mr. President, in the next few weeks, we'll be launching the Basic Healthcare Provision Fund that will be a leap towards a situation where no child, no woman in Nigeria will ever die from preventable causes.
Recent data places Nigeria at 58% immunization coverage, which is some distance from the 85% target by the federal government. But there are some positives to this figure.
We are on track. The trajectory that has been set up is actually being followed or even surpassed. So we're not worried. We see that the right ingredients are in place. There's strong coordination from the NPHCDA. For the first time, we have one plan. So everybody who is working in immunization is keying into one particular plan.
From this workshop, participants are expected to develop a national quick action plan in collaboration with states, local government areas and partners among others to ensure no child is left behind.
The World Bank with the federal and the Adamawa state government is taking over 6,000 teachers in areas affected by activities of Boko Haram. The training is aimed at closing the gap created following the devastation inflicted on education by Boko Haram insurgents. The Adamawa State Commissioner of Education, Julius Kadala, who supervised the distribution of furniture and materials in the Hong local government area, says the teachers are being given other forms of incentives.
The 7 local government areas in Adamawa State affected by activities of insurgency where schools were destroyed have continued to receive intervention from international organizations, government and well-meaning Nigerians. They include Madagali, Michika, Meha, Mubi North, Mubi South, Hong and Gombe local government areas. Governor Mohammed Jibril, in company of members of the State Executive Council and stakeholders in the education sector, are in the government secondary school Hong to flag off the distribution of furniture and instructional materials for schools. The governor takes time to inspect the materials, which include textbooks, desks and chairs. He laments the poor condition of schools as well.
There is nothing one cannot compromise when it comes to education. It is very, very important in our life. When we came in, we all know because that we started this government together, my team, the commissioners, the education sector was completely neglected. Education is going to be #1 priority for this government.
In his vote of thanks, the state chairman of the Nigerian Union of Teachers, Comrade Rodney Nathan, appreciates government for its intervention in the education sector.
And when you came in, you didn't look at education as being expensive, because I want to believe you had that added and you hold it to yourself. That education is the bedrock of everything. Whatever you want to be or you want to become in life, you have to pass through the 4 corners of the classroom. And you paid all your attention to the plight of teachers in Adamawa State. So I want to say thank you.
With this flag off and distribution of these school materials, there will be an improvement of teaching and learning in the communities liberated from the control of the terrorists.
Still to come on the program, an apitherapy practitioner in Cairo says he's using live beat acupuncture to treat several illnesses. Please stay with us.